Hi, my name's Penny Snowball. This is the 12th in a series of 12 short documentaries entitled In Search of My Mental Health, The Road to Recovery. And we are going to be discussing in this final part of the series what is the truth behind the treatment and that is provided, and what could be done to improve it. Just rounding off really with to open a debate, for what is actually available and just how could it be improved and what's on offer, the reality of what is on offer. So my experience is that, having come out of rehab, which I got funding, I got funding for, there wasn't any funding available for me. I applied for every single place to try and get it, but because I wasn't drinking, there doesn't seem to be, in this country anyway, any funding really, not that I've come across, for somebody who's, let's say, the codependency, the love addiction and all that. So there doesn't seem to be any funding for that. It's either for drugs and alcohol. And as we've already discussed, the codependency in relationships can often take people back to the drinking. So I was fortunate to get a funded place, private. There was somebody who had left some money for somebody to go, which is why I went into the treatment centre. But when I came out, I wasn't in a position to financially afford to continue to see a therapist, because they're £50 an hour roughly, 40 to 50 generally. I waited 5 months to see a psychologist. I've just seen a psychologist. I did get to see a psychiatrist after, I think, probably about 6 weeks. I got to see a psychiatrist, and then I saw him every month for like half an hour. I found that very distressing, because he doesn't seem to understand addictions. He tries very hard, but he doesn't seem to understand addictions. And I find personally that there's a sort of brush off. It feels that there's I've forgotten the word for it really. It's kind of like they're doing the best they can with what they've got, but it might not actually be what you need. It's almost like firefighting. That's the sort of the terminology. It's like firefighting. Stick a plaster on it, hope it stays for a while, and then when the plaster falls off, they'll be back again. I don't know. That's my experience of it. And
I think there's a very much two-tier treatment. A method of treatment. There's the program for people with lots of money, and there's the program for people with no money. The program for people with lots of money, and which is up to £4,000 a week, as you were saying earlier, you can get it for around about £500 to £600 a week, which is still way above the normal person's income or available money. That treatment process is where you go into a treatment centre and you have full attention for some time to enable you to move forward within the recovery process, and then you also get aftercare with that and follow on treatment. Then there is the NHS, where they've done it, and they have some treatment centres, but they are few and far between, and they are very limited in the number of people. Normally they only take in people who are extreme cases. They don't take in the average person who comes along and wants some help with their problem use. And the other problem with that is very often they are manned or staffed by people who have not got what I call the true skills of being able to work with people with drug and alcohol problems, because they haven't experienced it themselves. They're well-meaning nurses and doctors and people who have worked through the NHS and probably trained in drug and alcohol treatment, but their training has been given to them by other people who don't know about drug and alcohol, the process of drug and alcohol. So they don't quite have the real understanding of what goes on for people who have a drug and alcohol problem. Therefore, the first initial point is that the people going in to those centres for treatment have a resentment, because the people they're working with or are trying to help them don't really know what they're talking about. And they become very aware of that very quickly.
Yeah, without a doubt.
So people who go into those treatment centres find it very difficult. Those who don't get into it have to go to other agencies outside of that. Again, they're mostly manned by nurses. People may have had some experience of drug and alcohol problems, but very often haven't. And again, they don't feel comfortable within that process. I found, being somebody who has been through the process, when I worked in SADAS, I was asked time and time again for somebody who had actually had the problem to work with the clients that I was working with, and they were asking for that because they felt they weren't being understood.
Yeah,
And so I think one of the big improvements that could be made is that the people who work with, and I was lucky, the treatment centre I went to, it was run by an American couple who would only employ people in recovery. So every counsellor and every worker there was in recovery. So there was a huge empathy of what was going on. It was tough, but the toughness was with love. And I think this is what is really missing.
Yeah.
And we talked about this earlier. People who are going through that tough process of recovery, the boundaries have to be very strong. But within that, they have to be nurtured and held, because these are people who are working very hard at trying to get into recovery.
Yeah, definitely.
So it's a word that's is laughed at very often, but I call it love, and it has to be a loving process.
Yeah.
And the only people who can really understand and do that, I think, is people who've been through that process themselves.
Yeah.
And it needs to be available.
Yeah.
And it's not available. That's the problem we have at the moment. So yes, at the moment I think it's estimated, what is it, about 20% of the people who actually attempt to go into recovery actually make it for 2 years.
I don't know, I haven't heard that one.
That's the figure, the last figure that I heard, and that was back in 1994, so it's probably not as much as that now. I don't think it is, because the pressures are on now for quick turnover, quick turnaround, and so I know at SADAS the last criteria was that people should only actually have 6 sessions of counselling. They were allowed 6 to 12 sessions.
But nowadays, don't forget, the move is more towards brief interventions and not counselling, though you're using some counselling skills, because brief interventions can be delivered cheaper, because you can have very brief training on the effects of alcohol, behavioural changes that you might be able to make, all that sort of thing. But it's not counselling, it's more how are you going to move, rather than understanding the underlying issues. Because of that sort of scarcity of money. Can't afford counsellors because it costs a fortune to do the training and takes years, whereas you can train people to do brief interventions.
Cognitive behavioural therapy and solution focused therapy, and they can do that very quickly.
Yeah.
But that doesn't deal with a lot of the...
Well, as Sandra said, what you're getting people who are taking a very short training to train, and those people will lack the empathy and the skills and qualities of a professional counsellor. And I think that is a real problem again, because the nurturing tends to go in, and I think it also puts the people who are doing the work at risk of high stress and real problems, because they won't be achieving what they want to achieve.
Yeah, I definitely agree with you in terms of this. It's fundamentally, it is about love. It's about being held, nurtured, supported while you're going through something really difficult.
Because most people have spent the whole of their lives feeling unloved,
and judged and blamed.
Absolutely.
And there are, as we've said before, there are some very punitive people out there, some punitive, quite shaming counsellors. And for me, my experience of that has been that just totally re-traumatised me, and it doesn't help. It really doesn't help. It takes a long time to come back from that experience, because it taps into a wound that's already there. It taps right into it.
And also, I think there's been a shift, hasn't there, in the last year or so, that instead of working with people towards abstinence at their own pace, now everything is based on abstinence for abstinence sake as quick as possible. So the harm reduction is gradually being phased out, from what I can see, with the National Treatment Agency, and it's you've got to get yourself cured, and if you don't want to get yourself cured, you'll have your benefits cut.
Yeah.
You know, that's all been in the papers fairly recently.
Yeah, that's
and that coercion.
Yeah. Back to shame and punishment and all of that
Yeah.
stuff, isn't it? And lack of empathy.
Yeah.
Where's the love in that?
Oh, yeah.
You don't do what you're told, we're going to take your money away.
Yeah.
Not a loving process at all.
Not really.
And get better quick.
Yeah.
And do it in 6 weeks, otherwise you're in trouble.
Yeah. Yeah.